Welcome back to another bonus episode of the Plant-Based DFW podcast. Let's start with telemedicine and how that works.
I have been working in telemedicine and urgent care for a while and decided to open my own practice. With urgent care, you only have so much time to tell people about the plant-based diet, and I think that's the most powerful message that we could give our patients right now because it's such a strong effect, a healing effect. So I decided, hey, I want to open my own practice. And through my telemedicine experience and working with these telemedicine companies, I've accumulated licenses over the years. Right now, I have 42 states and counting. So the goal is to be nationwide to offer this service anywhere you live in the United States, eventually Guam and Puerto Rico and and American territories as well.
So how can we encourage people who are interested in having a plant-based physician to sort of be comfortable with that transition of seeing their physician via telemedicine?
When a new technology comes out, people don't always adopt the technology. It's like the coronavirus has nudged us this way. And since I've been working with telemedicine for the last 3 years, 100%, I really feel that the technology sells itself. As soon as somebody does a telemedicine visit, they can't believe that they ever, rushed to a doctor's office, ever sat in a sick waiting room with people coughing on them, was late to the appointment and had to pay a late fee and then, going. So nowadays, telemedicine is just going to be the standard of care. So the biggest complaint that people have about the idea of telemedicine is the exam. For a primary care doctor, over the years, you tended to think of a doctor coming to your house and listening to your heart and with a little black bag. And those days are, of course, over. And then what happened, you're in the office and people are coming to you. And then once the electronic medical records happened, the doctor's on the computer, staring at the computer, typing in everything. And less exam actually happened and less laying on hands. But honestly, what does your primary care doctor do? He or she educates you, maybe gets you to see a specialist or writes for preventative care. And these things are totally doable through telemedicine. In the case of an urgent care situation, you're short of breath or your child has a bad ear infection where you just can't look inside someone's ear on telemedicine without appropriate technology. If you're in this situation, urgent care is what you need. Well, woman care is best, through GYN. Obviously, you need to have some doctors who are totally procedure-based. And that's where a primary care doctor can get you referred. So I think it's all a win.
Who are typically your patients?
The patients I have as a family doc are from all walks of life. They're people who have a lot of resources and some that have very few resources. And especially in the military, we get access to people from all walks of life. So some of my patients are elite athletes and some of them are highly sick. They have lots of medical problems. Some of them are debilitated and can't make it. Some of them are housebound, can't actually make it out of their house. So telemedicine really helps.
If I come to you and I'm interested in having you as my physician, what would be the first step?
Great. So we'd meet each other. We'd have our first visit. You sign some paperwork so that I could get medical records from your last doctor. If you had problems like diabetes, we draw blood work. If we have an office and we're brick and mortar office, we would do blood work for diabetes. We would follow your hemoglobin A1C. If you had a thyroid problem, we would follow your TSH, the thyroid stimulating hormone. And we would meet you back. And I'm connected with an EMR called Athena Health. And just like all the other EMRs, they have a patient portal. And when we order the lab would come back to the patient portal. The patient would be able to review it themselves. And then we would discuss, maybe have a follow-up appointment to discuss, just like you would with a brick and mortar doctor. Mm-hmm. Our intent is to develop a group of telemedicine doctors who can provide consults so that we can be 100% telemedicine. When you have you need to have a certain brick and mortar aspect for procedure-based specialties, but there are doctors out there who are specialty-based, but because of COVID, they're at home and they can offer consults and can discuss. And it all depends on how many licenses they have. So the goal is to find a group of plant-based, like-minded doctors who are willing to take telemedicine consults and that will be down the pike real soon.
Insurance companies and how that's going.
Right now, the only one that's on board right now is Medicare, unfortunately, but I have applications out with Aetna, which should be in 6 weeks, Cigna, same thing, 6 weeks, Humana, Blue Cross Blue Shield, WellCare. And so I'll be adding these insurance companies like feathers in my hat, and watch my site, my Facebook site, Vegan Primary Care, and I'll set up alerts to as soon as I get new insurance coming in. Patients are educated on how to monitor it. If they're going too low with their blood sugar, they're back off. You can do a protocol where if they're taking daily long-acting insulin to be able to wean back themselves. Every 6 weeks we might do blood work if we're made of a drastic change. But most of this stuff can be monitored by the patient at home. Diabetics have a glucometer, and people with blood pressure have their own blood pressure cuff. These are cheap now. You can get them for $35, and you can monitor your own blood pressure. If you're getting dizzy, you simply decrease the med. How would people get in touch with me to let them know there's a change? With a portal, and with any of these electronic medical records, they have a portal, and you have direct access to the doctor through messaging. And you just a patient could put in a question, and we could make direct feedback right there. So that once you get a relationship with the doctor, for instance, if you came in with Vegan Primary Care, you'd have access to that, and we could go back and forth. Just go to veganprimarycare.com. You can hit book appointment. If you're on a desktop, you'll see the book appointment sign. If you don't see the book appointment sign, click the menu and you'll see portal. You sign up to be a patient on the portal. And once you're in the portal, you can make appointments, and we can message back and forth. And I really look forward to it. I look forward to your good health, and take back your health. Come see Dr. Harrington, and I'll be your vegan doctor.
So what do you guys think about the future of telemedicine? Do you feel a little more comfortable about choosing a vegan doctor who is available in the comforts of your own home and who also is on the same page about nutrition? Let me know in the comments below. And again, thanks for listening. You've been listening to the Plant-Based DFW podcast show. If you like our content, please like, share, and leave a review. Our goal is to provide quality episodes to help support the community. Remember to subscribe to our channel to hear more great episodes like this one. Links to our YouTube channel, newsletter, podcast, and links for our guests are also located in the show notes.